Rural trauma is one of the most difficult things to cover. And really in most of the country, there are large areas like this. There's no physically established trauma center. So if you were significantly injured in Onslow County, you either waited on the scene for a helicopter to fly you an hour and a half away, or you went to a hospital that would do their best to stabilize you, but still had to leave. So we just had no ability to keep anyone in the area, by their home, by their loved ones, or care for half the injuries that were present. It took buying new equipment, changing the facilities, changing our processes. And the center that they used to call Sleepy Old Lejeune now became a really busy trauma center. So it was a massive amount of work and huge undertaking that really took place over about a 6-month period once we were given the permission to proceed. There is a national body that accredits us that says you are doing everything the way you should, the same as any other trauma center in the country. There are 3 top injuries: are car crashes and motorcycle crashes. Falls, those are both high falls off of buildings, off of structures, and our geriatric population with falls from standing or off of stairwells. And then our third highest is what we call penetrating trauma, which is gunshots and stabs. And then we have criteria that we look at with the county and the state that say, you're a trauma patient, but are you bad enough you need to go to a trauma hospital, or can you just go to a community center? The goal of the military is to be prepared to deploy at any moment, anywhere in the world, and fix whatever you see. And unfortunately, in a lot of military medical centers, when you're at peacetime, you don't see traumatic injuries. You don't see the gunshots, the knife wounds, the high car crashes, things like that. So having a trauma center in a military facility means that every day, every hour of the day, our entire team is standing by ready to teach trauma. And people get worried because they hear that, our name is Naval Medical Readiness and Training Center, Camp Lejeune. We are a training center in the sense of we're getting ready for deployments, but we are not a large academic hospital. I think of it as an advantage. In this center specifically, we do have residents and they work as part of the team, but they are not the core providers for trauma. So the chief people in the Bay that are treating you, if you're a trauma patient here, are board certified and licensed physicians. About a year into it, especially when COVID hit, and no one could leave the county. There were no beds in any hospitals anywhere in the state. We were the only option. When New Hanover, our partner down south, had to go on diversion because they were so full, those patients were diverted to Naval Medical Center. It was just amazing to see that. Through our partnerships with the community, we've grown from just Onslow County to 5 counties now primarily that bring us patients. Because that reputation is out there, our impact has grown, and people know that we can help and we can handle a lot of things. The impact you can have on such a wide population, even though we're a small center, is incredible. There are patients today walking around that come back to our Trauma Survivor Day walk and walk with us at the Trauma Survivor Day that would not be alive if it wasn't for Camp Lejeune. There's a list of people that have to show up to a trauma because we require them to be there and the ACS says we need them there. But the impact is command-wide and hospital-wide. People get forgotten quite often because they're not necessarily the one that's putting in the chest tube or intubating the patient in the bay. They're the one caring for them 30 days after they're admitted. They're the ones doing all the follow-ups. They're the people that come in and clean and turn the trauma bay so that we can take another one minutes later. So I think that, one of the things that we do need to recognize is how much work goes into it, how many people in the command are involved. Everyone does their job as hard as they can, and that's the only way this place continues to succeed.